venous anastomosis, and you will draw these diagrams. 1, 2. Oh, this diagram that is almost the same like this. That is why I will not ask you this one, but that is third diagram, fourth, fifth, sixth, and fetal circulation. This diagram.
Those diagram we need to draw?
Yes. And in time of your written test on last classes in this semester, you also will draw these diagrams. First diagram that is easiest, cava-caval anastomosis in posterior abdominal wall. Look here. That is superior vena cava, vena cava superior. It forms with the help of brachiocephalic veins. And inferior vena cava, vena cava inferior, and common iliac veins. Here it is vena, help me, vena lumbalis. This one, vena lumbalis ascendens. On the right side, it continues into azygos vein. On the left side, hemazygos vein. And now easiest anastomosis, cava-caval, because vena lumbalis ascendens conduct blood to superior vena cava and vena lumbalis into inferior vena cava. And here it is anastomosis between system of superior vena cava and inferior vena cava. Clear it is. That is first diagram, this one. And now I continue to draw this diagram, anastomosis in the region of vertebral plexus. Look here, that is internal jugular vein, here it is subclavian vein, here it is the same, and it is vertebral vein, vena vertebralis. It opens into brachiocephalic vein, vena vertebralis. And in the region of vertebral column, we have vertebral plexus, plexus vertebralis internus in vertebral canal, and plexus vertebralis externus anteriorly from bodies of vertebra. And from external vertebral plexus, from plexus vertebralis externus, start vena intervertebralis. And vena intervertebralis in cervical department opens into vena vertebralis. Then, in thoracic department, here it is accessory hemazygos vein. And what are these veins? Vena intercostalis posterioris. Here it is vena intercostalis. And vena intervertebralis in thoracic department opens into vena intercostalis posterior. Here and here and here. Vena intervertebralis goes to vena intercostalis posterior. And in lumbar department, vena intervertebralis opens into vena lumbalis. Vena lumbalis. That is why from vertebral plexus, blood goes to vertebral vein and then goes to superior vena cava. The same from vertebral plexus, blood goes to posterior intercostal veins and then goes to azygos and also superior vena cava. And in lumbar department, it goes to lumbar veins, vena lumbalis, and vena lumbalis opens into inferior vena cava. That is why vertebral plexus, that is anastomosis between superior and inferior vena cava. Clear it is? That is next diagram, this one. Here it is vena intervertebralis, should opens into posterior intercostal vein. It is maybe not so clear. Should be opens into vena intercostalis posterior. And here it is opens into vena lumbalis. Clear it is. What you need to write in this diagram. Number one, vena intervertebralis. Here it is the same. Number one, and here, and here. That is vena intervertebralis. Number two, vena vertebralis. Number three, vena brachiocephalica. Number four, vena cava superior. Number five, vena cava inferior. Number six, vena lumbalis. Number seven, vena lumbalis ascendens, the same here. Then number eight, vena azygas. 9, vena hemiazygas. Number 10, vena hemiazygas accessoria. And number 11, here and here and here and here, vena intercostalis posterior. That is caval anastomosis in the region of vertebral plexus. Next diagram. Well, I start from this diagram and then we continue to this one. Look here. That is superior vena cava, vena cava superior. It is brachiocephalic vein, internal jugular and subclavian. And subclavian vein, that is continuation of axillary vein, and here it is the same. Then inferior vena cava, common iliac, internal iliac, external iliac, and femoral vein. What is the border between external iliac and femoral? What is it? Inguinal ligament, yes. And now, on anterior abdominal wall, we have venous network. That is anastomosis in the region of anterior abdominal wall. Under the skin, we have venous network, and from this network, vena epigastrica superior continues into, help me, vena thoracica interna, and internal thoracic vein opens into brachiocephalic vein. Then the same, vena thoraca epigastrica continues into, it's joined with vena thoracica lateralis, and thoracica lateralis opens into axillary. Sometimes thoraca epigastrica directly opens into axillary. Sometimes it's joined with vena thoracica lateralis. Then downward, here it is, vena epigastrica inferior goes to vena iliaca externa, and vena epigastrica superficialis opens into femoral vein. Clear it is? That is caval anastomosis on anterior abdominal wall. Number 1, superior vena cava. Number 2, brachiocephalic vein. Number 3, subclavian vein. Number 4, axillary vein. 5, vena epigastrica superior. 6, vena thoracica interna. 7, vena thoraca epigastrica. 8, vena thoracica lateralis. Number 9, vena cava inferior. Vena iliaca communis. 11, vena iliaca externa. 12, vena femoralis. 13, vena epigastrica inferior, and 14, vena epigastrica superficialis. And from this network on anterior abdominal wall, the same it is portal vein. And what is the name of these veins? Which goes to portal vein from network on anterior abdominal wall. Vena para umbilicalis. Vena para umbilicalis. That is why number 15, vena porta, and 16, vena para umbilicalis. And we receive porta, cava, caval anastomosis on anterior abdominal wall. Clear it is? that is, it is only cava-caval anastomosis without portal vein, and this one, that is porta-cava-caval anastomosis, that is like here. It is. I will ask you only this diagram. Porta-cava-caval anastomosis. Next. That is the stomach. Here it is liver. That is portal vein. And here it is vena gastrica sinistra. From lesser cavity of the stomach directly goes to the portal vein. And here it is esophagus. And from abdominal part of esophagus, vena esophagealis opens into left gastric vein and goes to portal vein. And from thoracic part of esophagus, venous blood goes to what? Azygous vein, and azygous vein opens into superior vena cava. Superior vena cava, vena esophagealis. Well, the same goes to hemiazygous vein here. Accessory hemiazygous, it is not so interesting because blood goes to azygous vein and continues to superior vena cava, and we receive anastomosis in the region of abdominal part of esophagus. Blood goes to left gastric vein, and also blood goes to azygous vein, and we have porta-caval anastomosis in the region of abdominal part of esophagus. Clear? Next. Look here. That is, it is inferior vena cava. Vena cava inferior. Internal iliac vein, external iliac vein. And internal iliac vein gives vena pudenda interna, And now, here it is rectum, that is a rectum. Canalis analis. And here it is liver and portal vein. Vena rectalis superior continues into, help me, inferior mesenteric. It goes to inferior mesenteric vein. Vena rectalis media goes to internal iliac vein, and vena rectalis inferior goes to pudendal vein. And we receive anastomosis between inferior vena cava and portal vein in the region of rectum. Porta-caval anastomosis in the region of rectum. Upper part of rectum conduct blood to inferior mesenteric and portal vein. Vena rectalis media goes to internal iliac. Vena rectalis inferior goes to internal pudendal vein. It opens into internal iliac into common iliac, and common iliac into inferior vena cava. Number 1, vena cava inferior. Number 2, vena iliaca communis. 3, vena iliaca externa. 4, vena iliaca interna. Number 5, vena porta. 6, vena lienalis. 7, vena mesenterica inferior. 8, vena mesenterica superior. And now, number 9, vena rectalis superior. Number 10, vena rectalis media. 11, vena rectalis inferior. And number 12, vena pudenda interna. Porta-caval anastomosis in the region of rectum. Give me another paper. inferior vena cava, common iliac veins, vena lumbalis. It is ascendens colon ascendens, it is colon descendens. And blood from posterior part of colon, because ascendens and descendens colon has mesoperitoneal position. Posterior wall have not got peritoneum. That is why blood from posterior side of ascendens and descendens colon can goes to inferior vena cava, and you know that it is portal vein, vena lienalis, vena mesenterica inferior, and vena mesenterica superior. Superior mesenteric vein receive vena colica dextra, and inferior mesenteric vein vena colica sinistra. And we receive anastomosis, porta-caval anastomosis in the region of ascendens and descendens colon. Blood from these two parts of colon goes to inferior vena cava and goes to portal vein. Number 1, vena cava inferior. Number 2, vena lumbalis. Number 3, vena colica dextra. Number 4, vena colica sinistra. 5, vena mesenterica superior. 6, vena mesenterica inferior. 7, vena lienalis. And 8, vena porta. Okay. And last diagram, that is diagram of fetal circulation. This one. Okay. It is placenta. It is placenta. And from placenta, oxygenated blood through vena umbilicalis goes to fetus. And it is liver, that is portal vein, and you already know that umbilical vein opens into portal vein, vena porta. And venous duct, ductus venosus, from umbilical vein goes to inferior vena cava, vena cava inferior. In inferior vena cava we have deoxygenated blood, and oxygenated blood through umbilical vein, then through ductus venosus. Number 1, umbilical vein. Number 2, ductus venosus. Oxygenated blood goes to inferior vena cava and mixed here with deoxygenated blood. That is first place where blood mixed. And this mixed blood goes upward. It receives portion of deoxygenated blood from liver. What is the name of these veins? Number 3. What are they? Vena hepatis. They also bring deoxygenated blood into inferior vena cava. Number 4, that is vena cava inferior, and it is second place where blood mixed. And after that, inferior vena cava opens into which chamber? Right atrium. It is right ventricle, that is left atrium, ventricle, that is septum interatriale, and it is interventricular septum. And blood from inferior vena cava goes to right atrium, and from here goes through foramen ovale in fetus and goes to left atrium, that is left atrium. From left atrium, blood goes to left ventricle, and from left ventricle, what starts from left ventricle? That is aorta. what is it? Aorta subdivides into common iliac arteries. Here it is internal iliac and external iliac arteries, yes? Now, that is superior vena cava, and deoxygenated blood from superior vena cava goes to right atrium. Here it is right atrium. From right atrium goes to right ventricle, and from right ventricle continues into pulmonary trunk. But in fetus, lungs not participate in breathing. That is why it is not necessary to conduct whole this blood through lungs. That is why most part of deoxygenated blood goes from pulmonary trunk directly into aorta through ductus arteriosus. And this ductus arteriosus opens into aorta below from left subclavian artery. And here it is blood mixed one again. And from this place, blood which is poor with the oxygen because it mixed with large portion of deoxygenated blood from pulmonary trunk, goes to thoracic aorta, goes to abdominal aorta, goes to lower extremity, and this mixed blood from internal iliac artery continues to umbilical cord and goes to placenta. Clear it is? That is umbilical artery, arteria umbilicalis. We finished with number 4, inferior vena cava, number 5, superior vena cava, number 6, help me, foramen in fetus, foramen ovale, number 7, aorta, number 8, pulmonary trunk, number 9, ductus arteriosus. And ductus arteriosus opens into aorta. Aorta subdivides into common iliac arteries. Number 10, 11 that is external, 12 that is internal iliac artery, and from internal iliac artery, number 13, that is arteria umbilicalis. Number 13, arteria umbilicalis. It conducts mixed blood with that is the venous blood or deoxygenated blood, goes to placenta where exchange of gases take place, and one again oxygenated blood through vena umbilicalis. Here it is number 1 the same, vena umbilicalis, and ductus venosus goes to inferior vena cava. I put here 14. I forgot to put